sustainable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
Yes, welcome everyone. Thank you for joining us here on Zoom, as well as those who may be watching through the live stream on Facebook and YouTube. My name is Julia from the SIHI Secretariat, and I will be your host for tonight. And so, well, maybe today. So today's session is a crossover episode between SIHI Talks and the Let's Talk Social Innovation in Health series that is led by our SIHI hubs at SIHI Malawi, at the Kamuzu University of Health Sciences, and SIHI Rwanda at the University of Rwanda. And today we will be talking about a social innovation for mental health, with the title of today's session being Leveraging Digital Platforms to Improve Access to Mental Health Services. So the program is pretty straightforward, with our guest speaker who will be introduced shortly, sharing an expert discussion. And afterwards, we'll entertain questions and comments, which you can send through the chat. And give a bit more background on what we'll be learning in today's session. And to introduce our speaker, may I call on Mr. Andrew Hamuza, the Hub Coordinator of SIHI Malawi. Andrew, are you there?
Hello, everybody. Welcome to this episode. As Julia has mentioned, this is a crossover of SIHI Talks, as well as a second episode of webinar series, a monthly webinar 10-part series of Let's Talk Social Innovation in Health, which is set to pretty much just bring in up-to-date information in the field of health, as well as bring together professionals who are interested in a variety of topics. And for this episode, we'll focus on mental health, particularly on leveraging digital platforms to improve access to mental health, which will be delivered by our speaker today, Tendai Machaya. So Tendai is a counseling psychologist from the St. John of God College of Health Sciences. He's also the head of department at the institution. And for his background, he's currently a PhD candidate with the University of Johannesburg, focusing on critical positive psychology. So he does hold much experience as well in the field, and we're hoping to learn from him. Because the other interesting part is he's one of the innovators that we worked with after the hub had put out a call for local solutions within Malawi, targeting those that are addressing gaps within climate change and mental health. So yeah, let me welcome Tendai to this episode, and I hope he's ready to share with us what he's prepared. So thank you.
All right. Thank you very much, Andrew, for the introductions, as well as Julia for starting in the session. Before I share my screen, I think you may need to see who is behind the camera and who will be actually sharing some social innovations in Malawi. So I think to start off, let me share my screen. And I believe in the next 20 minutes, I will share my presentation. And then afterwards, we invite questions from the audience, as well as maybe clarifications and also maybe some input from the participants. So I should start sharing my screen now. You should be seeing my screen now. Hello?
Yep, you see it here.
Okay, perfect. All right. Good day once again, colleagues. I'll take you through this kind of innovation that we have witnessed in Malawi for the past 4 or 5 years. That is with us. And I'm glad that I will be sharing with you the successes that we have encountered as an institution, and also to make sure that maybe this innovation will assist in accessing mental health services, not only in Malawi, but also across the globe. So today, our topic is on leveraging digital platforms to improve access to mental health. I think these days we are now talking of the digital space. Everything is about how can we occupy the digital space in everything that we do and in our day-to-day work. So as in health and innovations, there's no way we can leave behind the digital space to actually leverage our performing of duties. So this presentation is coming from me, like what you have heard, Tendai Machaya from St. John of God College of Health Sciences. So I will present to you the outline of my presentation, where I will look at the background of this innovation. I will also share the success story of us as St. John of God, and also how we have leveraged this technology for mental health access, and also to go through what are the digital tools that we have used, and also some of the tools that can be harnessed to actually leverage the access of mental health services. And also, I'll look at the benefits of this leveraging of technology to improve access to mental health. But also, I'll also look at the barriers or the challenges that we have faced in trying to implement this kind of an innovation, but also coming up with some possible solutions on how best we can actually improve on service delivery. And also, I will look at the future implications. What are the future implications in as far as digital health is concerned? And lastly, I will move on to the closure. Then we invite questions, and then it will be a question and answer session. Yeah, so in brief, I think I may need to share with the participants who we are as St. John of God. So St. John of God itself is an institution that is found in Malawi, and it provides both outpatient and inpatient services for mental health clients. So this service offers two programs, so to speak. We have the service side, where we provide this mental health service both for outpatient and inpatient clients. But also we have a college where we train mental health professionals, we train psychiatric nurses, we train mental health clinicians, we also train psychotherapists. So this college is actually one of the institutions in Malawi that is providing mental health personnel, and actually covering the gap that we have in Malawi for human resources in as far as mental health is concerned. So we do have two centers. One is here in Mzuzu, where I am based, and also we have a center in Lilongwe, area 43, where we provide these services. So in Lilongwe, we provide a number of services, which include the rehabilitation center, which is there. And also we provide a child psychiatry unit, which is also based in Lilongwe. So for these services that we do, we provide both what I can say a hybrid kind of service in as far as provision of mental health service is concerned. So this hybrid kind of approach, which I refer to as the brick and click approach, is what we have now embraced as an institution to answer to the core of mental health support in Malawi. So this institution is St. John of God. I think we are doing a great job in as far as delivery of mental health services is concerned, because we work with the government and also other partners to try and alleviate the problem of mental health in Malawi. So to start the ball rolling, I would like us to imagine a situation whereby an individual in a remote area, an area that has been affected by a disaster, right? And that person is able to access mental health service just at the click of a button. That scenario is the one that we pride of as an institution, to say now we are able to reach to those hard to reach areas, and also to sort of undeserving population as far as access to mental health is concerned. Just think of that scenario. Not only thinking about those people in the disaster affected areas, but also thinking of somebody who is at the comfort of his or her own home, who is in need of a mental health service and mental health support. So by the click of a button, you are there. You are with the mental health support service. So this is what actually fascinated us most in this innovation, where we are trying to bridge the gap that would have been created by geographical situations, and also some situational barriers. Some may not be able to visit our centers physically for the service, but they can access at the comfort of their homes, and also the convenience that it provides is actually that we are proud of. So this scenario is actually that will make us be proud of mental health support professionals. So we are saying these digital platforms that we're talking about that can bridge the gap can serve as a powerful complement to the traditional face-to-face counseling methods that we are used to. We are used to the face-to-face and also the physical visits of clients from their places to our centers. But now we are saying the coming of these digital platforms are there to assist us. But we are saying we are not actually, it's not a substitute actually of the face-to-face kind of service delivery. That is why I've said from the beginning that it's a kind of a hybrid approach, where we are trying to infuse the issue of technology and also occupying the digital space in the provision of the service. It's not that we are actually substituting or replacing the face-to-face kind of service delivery, but we are also trying to augment what we have and also to reach out to people at their convenience. So now, I think I will now need to share our success story on how this started and how we managed to navigate through the challenges that were there during that time, and that made us to actually try to upscale the provision of psychosocial counseling services through telecounselling. I think we all know that in 2020, at some point, business came to a standstill or came to a stop because of the pandemic COVID-19. And also as institutions, we faced a number of challenges whereby those lockdowns actually stopped everything. Life at some point stopped. But now we thought of this issue of how best can we reach out to the clients where there are these lockdowns. Movement was restricted. There were a lot of restrictions, but how best now can we assist our clients? So now this is when we thought of have a paradigm shift to the provision of mental health services. And now we thought of these digital solutions on how best we can reach out to our clients. So you realize that people were in isolation centers, and also some families were distressed at home because somebody's at the isolation center. So now this is when we thought of coming up with this issue of embracing the digital space to reach out to our clients who were actually needing the service at that moment. So the organization rapidly adopted the telecounseling mode of delivering the service, so that we ensure continuity to our job and our profession, and also our care during these lockdowns. And we have realized that the offering of telecounseling was quite impactful, and the approach itself allowed clients to receive mental health support from the safety of their homes without moving to our offices. And during that time, offices were closed again. But now we managed to reach out to their homes. We also managed to talk to them, whether they are in the isolation center. We could actually provide psychosocial support via text messages, via WhatsApp calls, and also WhatsApp messages, to try to give that service, so that they were cared for in these times of crisis. So statistically, I think from our records, we managed from the COVID time up to the post-COVID era, we managed to reach out to about 500 clients during whom we offer the service through telecounseling. So we can see that this is an impactful way of addressing the mental health challenges, despite the barriers that may come in, despite the pandemics that were there. So this was just COVID-19, but there are other pandemics or epidemics that may come, that may actually prevent the access to mental health care. But so this was a wake-up call, and we actually grabbed it. So to move on, as you can see, we have also, let me get back to this other one. Yeah. So on this one, it did not end on the COVID-19 pandemic only, but also we actually worked or we utilized this digital space during Cyclone Freddy when it struck in 2023. So as we were now familiar with telecounseling, we actually opted to adopt this kind of approach to areas that were hard to reach. Yes, the government, DODMA, were able to provide the physical needs of the people, but we thought of us providing the mental health aspect. That is when we also started to reach out to the people in those disaster-affected areas like Mulanje, Palombe, and Blantyre. Those were areas that were hard to reach. They could not travel to Mzuzu or Lilongwe for mental health support, but we could reach out to them through the telephone and other digital platforms that I will actually highlight in the presentation. So the outcome of this initiative ensured that the vulnerable population received immediate mental health support. So in as far as, you know, how it struck, the Cyclone Freddy struck Malawi, we were left with a number of vulnerable populations. Some people lost their relatives, and maybe up to now they haven't been found. So through the telecounseling service, we managed to give the immediate mental health support, sort of a psychological first aid to the survivors. Because when the survivors are there, you know, mourning their loved ones, bereaving their loved ones, they need that psychosocial support. So this demonstrated the flexibility and responsiveness of digital platforms in this crisis. So this is not only for COVID-19 or for the Cyclone Freddy, but we were also thinking for the future, that when the future comes in such kind of pandemics, we need to, we need to be found geared for the pandemic, so that we are able to provide mental health support timelessly to the people who are in need. So it showed that it is quite a flexible and responsive way of harnessing the digital platforms, especially during crisis. Yeah, so the current and future steps, when we are looking at the access of mental health, as we are using the digital tools, we can talk of video conferencing. This is one of the tools that we are using to reach out to our clients, those who can afford. We can engage them in Zoom meetings, in Google Meet, in Microsoft Teams, so that we can actually provide mental health support. They might be at the workplace during lunchtime. They need that psychosocial support. Then we can open a Zoom link, a Microsoft Teams, so that we can video conference as they receive the mental health support at the comfort of their office, at the comfort of their homes, and so on. And also, the future steps that we are talking about now, as an institution, St. John of God, we also have a section of disabilities, where we might say there is a gap now in as far as psychosocial provision is concerned, psychosocial counseling provision is concerned, because of those who are living with disabilities, especially those who cannot speak. So now we can also harness the digital space through sign language, right? And recently, our administration organized a training for all the members in the service for sign language. So it means now we have the basics of sign language communication. So we are saying nobody should be left behind in as far as the harnessing of digital space is concerned. Everyone should be on board, including those living with disabilities. So we also have that facility. Somebody who wants to want a psychosocial counseling, we can provide through sign language, because our teams have been trained to provide this kind of counseling. And also, we in the future, we are hoping to to utilize the artificial intelligence, whereby we can use chatbot to actually assist people. Just on the click of a button on our platform, you are able to be directed to a service that can assist you in times of need. So these are the current and the future steps that are there in our provision of the mental health support. Now, I may need to share with you how important is this service that we are providing. We have shocking statistics from the Malawi Police Service, where by the month of June, we had a total of 276 people who had committed suicide. So we are saying, when some of these people who might have committed suicide did not find anyone to talk to, it did mean that somebody had reached out to them, we could not have these soaring figures in suicide. So what it means is that as we leverage these digital platforms in the provision of mental health services, I think if we utilize them well, they will assist to reduce the rates at which suicide is happening in Malawi. Not only in Malawi, but also worldwide. So it is best that people get to this mental health support timelessly, not to wait until tomorrow to get the service. But as soon as they need the help, let them just click the button and also ask for service. So this is where we should go, and we will alleviate this challenge of suicide cases. Now, so what we are saying is that these technologies that we're talking about, they will actually alleviate the care. They will actually, it's a potential to create a future where equitable and effective mental health care is a norm, and meaningfully improving lives around the world. So there's no way we can actually avoid this digital space. I think we need to embrace it, because it has got a great potential. I think we have witnessed it. We are a living testimony as an institution on how this technology is actually assisting meaningfully in improving lives around Malawi and also around the world. So what it means is that communities should prioritize mental health care. So when we leverage these digital tools, like these chatbots that I've talked about, it will create an ever-present system of support where people can identify issues earlier and access whenever they need it. So earlier interventions are possible through telecounseling. So this is when we have earlier possible interventions, other than to wait for tomorrow when the office is open. But it is possible with technology to get the support as soon as you need it. You should access that support so that we prevent these casualties that we are witnessing each and every day. Yeah, so these are some of the tools that are used in mental health support, the digital platforms that one can actually use to try and access and also to leverage the provision of mental health support. So there are several applications that can be used that we are also thinking about. Issues to do with the medication applications that may be a reminder to someone to say you need to take your medication. We have relaxing sleeping sounds, medication reminders, and so forth. And also on this one, I think they are used in the Western and advanced world, but also it's high time that we embrace these kinds of tools so that we are able to get the mental health assistance that we need, not only from a person, but also from these digital tools, the applications that we will put in our phones, our mobile phones or smartphones. So some people may think that the smartphones are only for WhatsApp and so on, but if you use them wisely, they can be a better tool for mental health support. For example, you can use the digital sensor that can send data to an application. We have the sleep cycle trackers that you can put on a digital platform and other applications that you can put on the phone. So a simple phone can be a better tool towards your mental health support. Now, it is just a summary of the digital mental health transformations that can be used. So when you are using your phone itself, this is where where we are going, the digital interventions, working through towards the artificial intelligence. So through the phone itself, like I have highlighted above, we can use the mood tracking applications, mindfulness training, digital diaries that you can use on your phone, and also the issue of social networking itself, peer support. The groups that we have on WhatsApp, they can be a point to start your therapy. And also we can talk of other therapies that you can use on the platforms. Exposure therapy can be used, simulation-based training, and also the use of chatbots and all other digital tools that you can use can actually help to leverage us and also to access mental health support timely, not to wait for the psychotherapist, but also this can act as a first aid, and also the psychotherapist will then come in later. So why do we leverage these digital platforms? What have we noted as an institution and also in our implementation of this innovation? We have realized that it promotes shorter waiting times in as far as mental health service delivery is concerned, because an individual is reached out at his or her convenient time. So when you are in need, there and then you are assisted. So our platform as of now, St. John of God, we have a group of psychotherapists who are on the group, and also our administrative assistants they've been incorporated in that group, so that when somebody is called to ask for telecounseling, this admin secretary will actually direct the message to the group, and then anyone who will be free at that particular time will be able to assist that individual. So you get the service right right on time. So through the admin assistant, the client is introduced to the group, and then whoever is free at that particular time will take up the case, and that individual is assisted. So we have seen that it is working quite well, and we're improving on ways on how best we can upscale this, because it is quite helpful, and we've got testimonies that are living on this kind of approach that we have used. So it is also removing some barriers to treatment. Counseling and psychotherapy, it is associated with some stigma of some sort. So when someone is accessing the service at his home, nobody can see that he has visited St. John of God, a mental health institution, or an institution that provides psychotherapy. So nobody can actually notice that you have received or you have gone for psychotherapy. So the thing is, it has removed those barriers. The issue of stigma is no longer there, because somebody can access the service privately. So there is a lot of privacy in that mode of providing mental health service. And also from our statistics, we have seen that efficiency is actually improved. We used to have people waiting for psychotherapists on the foyer, right? But now we can see that it's no longer happening, because some are reaching out via telecounseling, because people may wait at the foyer, and also now the issue of privacy and confidentiality will be compromised. But now if somebody is accessing via telecounseling and using the digital space, issues to do with the confidentiality is enhanced, and also on our part, efficiency itself is actually enhanced. And also we have seen that this supports the prevention care model as preventive psychiatry that we offer. So as preventive psychiatry, we have seen that this is working very well, because we are actually assisting more people. At the same time, we are preventing them to degenerate into those psychotic conditions or extreme mental health problems. So this first line treatment that we are trying to upscale, it can be a tool that can be used, that may need to be supported, so that we reduce admissions in the mental health hospitals, like Zomba, for example. So if these hospitals are overcrowded, so to speak, it means this first line support, this psychosocial support is lacking. So the need for telecounseling now will actually enhance the service provision, will improve the numbers of people who are reached out, thereby less people will be hospitalized and admitted. So this is actually acting as a support to prevent the people to degenerate to the extreme mental health conditions. So this preventive model, like I'm saying, the first line treatment through telecounseling is actually playing a major role. So when we talking of telehealth, it actually reinforces better access to mental health. It is convenient, it is flexible. With your phone, you can actually get mental health support. So what is needed is just to maybe sensitize people on the benefits of this kind of mental health support. Because some may not be aware, but these kinds of platforms, I think, will assist us to reach out to many people that this service is available at St. John of God. So what are the challenges that we have faced? Yeah, so though we are saying that mental health, it holds a great promise, yes, the digital mental health provision, has got a great promise. But however, there are issues that are involved in actually delivering it to reach its full potential. So those are some of the challenges that we have encountered as we are trying to implement this innovation. As you are aware that no one or not everybody has got a smartphone who can be reached out on WhatsApp. That's an issue. So we are talking of the issue of infrastructure there. Nobody can, not everyone has got a smartphone. But despite that, the issue of a smartphone, yes, we can do the phone calls or the text messages with the small phones. But what we have realized that it is much more effective are these WhatsApp calls and WhatsApp discussions and so forth. So the issue of affordability of these tools, the phones that can be used, and also the issue of the networks themselves. So the internet connectivity might be a challenge in some of these areas. So what it means is that some people are hard to reach because the network coverage or connectivity in their areas is quite problematic. You notice that you might have an appointment with a client who says, no, let us be chatting maybe at 2 o'clock. That person is in Eutini, some kilometers away from the city center. And also, there will be challenges of connectivity there. So you will miss the appointment. So it's the issue that we may also need to talk with the internet providers so that they can assist in actually helping us to promote this kind of mental health support. It should not be only for the urbanites only or the people in the urban areas, but it also needs to reach to everyone. Like I've said, that it's something that should not leave anyone behind. Everyone should be on board, but the issue of internet connectivity. So this is an issue that also need to be lobbied for so that everyone is reached out. And some of the things are the issue of the digital literacy gap itself. So some people, they might not be able to use the gadgets that they have. So in a way, those are some of the things that we are facing. You might be in a WhatsApp call, yes, but all of a sudden, someone is not able to utilize the gadget, and it cuts off. So those are some of the interruptions that may come in. So there are a lot of technological barriers that we have noted that I've actually posted there that maybe we may need to consider. So there might be some overload of traffic. Maybe when you're engaging in a conversation, there will not be a smooth flow of such kind of a therapy. And therapy is based on communication. So once there is interrupted communication, then that session will not be an effective one. So what it means is that it has to be a very smooth kind of a session without any interruption. So these are some of the technological communication barriers that we have noted in this innovation. But how best can we address these, and what we also have tried to actually address these challenges that we have met? So the one of the things that we may need to do is to collaborate with the stakeholders, and these stakeholders will also include the service users themselves, to engage with them so that they see the value of telecounseling. And also we also need to talk about these issues with the technology developers and also the providers of the internet, so that they can assist us. And on this one, I think recently we had a meeting with the coordinator, the psychologist in Lilongwe, Dr. Ndumanini Sulungwe. I think we have plans that we need to engage with these internet providers so that we see how best we can collaborate and we work together towards the provision of these mental health services via the internet or telecounseling. We cannot live around the leave behind the policymakers for sure, so that maybe we get the support from them. The policymakers are very important because mental health itself, it has to be a priority now. So when you talk of the policymakers, they are there to support us so that we actually embrace the digital space in totality. So the users themselves, like I've said, the communities cannot be left behind, because this is where we have the service that these are the people who are in need of the service. So they need to be aware of the kind of service that we are offering. So I think it is best that as companies, as parastatals, we need to invest in innovation and research. This is very important, because in every field these days, we are talking of innovation, we are talking of research, so that when we are doing our practices, they have to be evidence-based. So, and also what is important to address this is to bridge this digital divide. We have to bridge the digital divide, maybe to have some orientations on how maybe these basic gadgets work. And the best way to do that is actually to advocate for digital literacy. We have to work very hard, hit the ground running, advocating for digital literacy. So here now, I think this is the last slide that I will use, so that maybe when we have an innovation, what should we do? And also, this is what we did when we came up with the telecounseling as a service, or as a paradigm shift to the provision of mental health services. So when you are having an innovation, community engagement is very important. And how do you go about it? So the first thing is to identify the idea. You have to collaborate with the idea, with the community. What do you have? What is the idea that you have, so that when you are implementing your innovation, it will not be a surprise, but it is something that they will be owning, right? So it's something that you need to think of, collaborate with the community, and then engage them by telling your story. Tell them the story, your story, and how beneficial it is going to be. Like what we did when we engaged this, it came from our clients, that now that we are unable to access the service, how best can we be assisted so that we continue getting the service? So they are the ones who actually came with the support to say, I think we need to be engaging online and virtually. So this is something that we may need to think about as we think of our innovations. And when we told our story to the people, we used evidence. You need to have evidence. This has worked somewhere, and now we want to implement this so that you are able to access the service. Give evidence on where it has worked. So for us, this is not new to the world. It has happened everywhere in the world, but now we wanted to adopt it in Malawi. So we had to use evidence. So it has worked here, it has worked there, so that they are able to identify challenges and opportunities before the implementation of the innovation. So I think this is just a framework that we may need to use when we think of any innovation that you may think of. This is what we used for us to come up with this innovation as an organization. So these are the materials for further reading that I was also consulting when I was preparing this presentation. So I think I've come to the end of my presentation. Over to you, Julia.
Thank you so much, Mr. Tendai. It was very inspiring to hear your commitment and effort to leave no one behind and help to cover all aspects of health, especially mental health. And here in the Philippines, we also face a lot of typhoons and climate disasters. So it was also at some point I could relate to it that we have to address the digital divide, and the way that it also addresses health inequities. So there are many ways and many problems, but we can open the access to services through digital platforms and explore this area more. But I think, as you said, no, there are also challenges that come with the digital divide and internet connection. And I think Mr. Spencer here has a very relevant question on this topic. So I will read it for you. So for everyone, so Mr. Spencer said, thank you, Tendai, for presenting on the initiative. One key challenge I have come across with providing healthcare services online is the administrative or policy issues around the services, among others. So how have you overcome this part when it comes to mental health services? For instance, if a patient needs to keep a record of the file, confidentiality issues, and managing referrals, who pays? How do patients get access to medicines, if any? It's a very relevant question. So maybe you can tell us more about this, Mr. Tendai.
Please come again with the question.
Well, it is on our chat, but how do you overcome the part on policy issues and administrative issues? For example, when a patient needs to keep a record of the file, there can be confidentiality issues. Also in managing referrals, who pays, and how do patients get access to medicine? So maybe you can tell us more about the operations of your service. So what exactly do the staff do to run the telecounseling service?
Okay, thank you for that question. In terms of confidentiality and also how we keep the file, this is actually something that is digitally provided. And also, like I said, we have a platform only for psychotherapists. We have trained psychotherapists who actually uphold ethical practitioners who are professionals. So which means the issue of confidentiality there is also upheld, because when we talk of referrals, it is only handled by the team that is providing telecounseling. And also nothing else goes beyond the group. And also when you talk of he has asked the issue of payments, what happens, the admission point of paying is the admin secretary. So when you are asking for the telecounseling service, the administration secretary will ask for payment, and then the payment is done via the specific account for the organization for telecounseling. So it is directed there. Then upon payment and producing evidence of payment, then you are directed to a psychotherapist in the platform. So this is how payment is done. When it comes to medicines, right? For our service as telecounseling, when it comes to the issue of medicine now, we don't have telemedicine facility. You have to come to the service now. But what we do is to provide sort of kind of psychological first aid on online. Then if there is need for other cases, then you may need to come to the hospital. So we have specific cases according to our guideline that are for telecounseling, but some cases are not for telecounseling. Because for somebody, if we assess a client, then we see that this client is suicidal, that case is not for telecounseling. But what can be done is to provide psychological first aid, and then physically to meet a clinician or a psychotherapist. So when it comes to the issue of record and filing, everyone who accesses or who calls the admin secretary is recorded in our files. Anyone who actually asks for the service, an inquiry is recorded. So what it means is that our files are also digitally recorded through the registry with the admin secretary. So this is where we have all the information of telecounseling from the registry that is registration that is done by the admin secretary. Yeah.
All right. Thanks, Mr. Tendai. So there's really a systematic approach, when it comes to digital provision of services. So we can ensure that it's ethical and ensure that the patients are getting the service. Okay. Mr. Richard Banda is raising their hand. Maybe they have a question.
Hello, thank you so much, Julia. And thank you so much, Tendai, for the insightful presentation. It was well detailed, and I've liked it. And I just wanted maybe just make one contribution, especially on the community engagement, and one way of addressing the challenge, particularly to those that don't have some mobile phones, and on the gap in terms of literacy, digital literacy. I was thinking that within the community, we may identify some professional leaders who can be be acting as a bridge between St. John of God and community members, where maybe they can be trained, and once they know what is involved, people can be reaching to them, especially those that have got challenges in terms of literacy, and those that doesn't have some gadgets. And then we are supposed to give them information in terms of ethical principles, that they shouldn't divulge the information. And I was looking at maybe identifying professionals that are within the communities so that they can act as bridges between St. John of God. So that's my thinking. Otherwise, this is a very good move in terms of reducing the burden that comes with mental health related issues. Thank you.
I agree. That was a very good suggestion, Mr. Banda. If you have something to respond, Mr. Tendai, to what you shared.
Yeah, sure. Thank you so much for that, Mr. Banda. I think it is a good move so that we uphold the issue of confidentiality and also the issue to do with the privacy. It goes a long way for the engagement of these communities so that they actually know the importance of counseling, as it is, like I said, the first line kind of treatment. If once they accept that it is a first line treatment towards mental health support, I think the communities will actually accept and embrace the initiative. Thank you so much, Mr. Banda.
All right. And if you have any more comments from the audience, you can also share them on the chat. And my last question will be from me. As Andrew mentioned earlier, that this telecounseling platform was identified by SIHI Malawi in a crowdsourcing poll. So as an innovator, what kinds of support would you like to see from SIHI or other partners in Malawi to further strengthen the innovation?
Thank you so much, Julia. I think we need to strengthen this kind of mental health provision in a number of ways. And we still need a lot of support that may actually see us upscaling the initiative. The first thing, we cannot run away from financial issues. The service itself, yes, we are providing for the people, but also the provider, the service provider himself or herself, is using his or her own phone. So we are mixing an individual phone, and also, these telecounseling issues. So what is important is that we need to have these gadgets to support the provision of the service. We also need maybe to carry out some sensitization outreach programs to these communities, especially the areas that are prone to disasters. I think we may need some community outreach sensitization workshops, and also to make sure that they are aware of the service, and also, like you have said, the digital divide itself. We need to actually work on it so that everyone is not left behind. We may also appeal to the internet service providers so that maybe the billing itself can be, the billing from the client side can be part of the service providers, so that maybe they provide the service sort of a toll-free. We have a toll-free line that may assist the provision of the service. So as of now, I think if we have a toll-free line as a service, I think that will help. But this is a self-funding project by the institution. But if we have this toll-free line that can be sponsored, I think it will actually take us a long way. So my appeal is maybe if we can get a toll-free line for mental health support, I think it will assist our clients, because it can be costly for a client maybe to text or to call. But if there is a toll-free line towards mental health support, I think it will go a long way to actually support those who are in need, but who are in undeserving communities. So I think those are some of the maybe issues that I can say we may need to upscale the provision of mental health services via telecounseling, and also to reach out to many people in Malawi. If that is sorted, then I think it will go a long way.
I agree, and I wish you continued success and support in your endeavors. So thank you very much for sharing your success story at the St. John of God College of Health Sciences. So that ends our session for today. Thank you again very much, Mr. Tendai, for your time and all the lessons that you shared with us. And thank you to our audience for joining us here on Zoom. We hope you keep supporting both the Let's Talk Social Innovation in Health series and SIHI Talks. So we have a post-webinar survey that we encourage you to answer, and in return, you can receive a certificate for this session only. And for those who are joining the Let's Talk Social Innovation in Health series for the first time, we are now on episode 2 out of 10. So I encourage you to stay on for the rest of the series to upskill and to receive a certificate. And you can do so by registering or contacting the email on the screen. Okay. So all previous episodes from both webinars are on SIHI's YouTube channel. And if you'd like to know more about SIHI, please visit our website or any of the social media pages as you see on the screen. So once again, thank you very much and enjoy the rest of your day.
Thank you, Julia. Bye-bye.
Thank you, Mr. Tendai.
Thank you, Julia.
Thank you, everyone.